Hello, welcome to HFMA Talk, the podcast for NHS Finance. I'm Sarah Day, Policy and Research Manager at the HFMA. In this episode, we hear from Sarah Brampton, Director of Finance at University Hospitals Plymouth NHS Trust. Sarah talks about the culture of empowerment that has developed during the pandemic, which has allowed good decisions to be made quickly. She highlights the importance of retaining this across both organisations and systems as the NHS resets. Hello Sarah, thank you so much for joining us today.
Hi Sarah, nice to see you.
So could you start by telling us a bit about your organisation and the population that you serve?
So I work for University Hospitals Plymouth NHS Trust, and we serve a population of around about 450,000. So that's for the city of Plymouth and wider West Devon and East Cornwall. And we're an acute specialist hospital, tertiary hospital, so we also provide specialist services for a wider footprint covering Devon, Cornwall and other areas in the southwest. So a large teaching hospital on the peninsula.
And how has Covid-19 been affecting you? I know that the southwest has got relatively low infection rates compared to the rest of the country.
Yes, so initially we obviously were gearing up for the large numbers that the bed modelling was suggesting that we would all see right across the country. So in the early days we were obviously planning for a surge of potentially seeing up to about 200, or the need for up to 250 ICU beds within our hospital. At the moment, our numbers got up to around about 100 patients in total. So that was at the peak of our surge, which was around about the middle of April. And within that, we didn't need quite as many ICU beds. So our ICU need was around about 15 on our worst day. So we haven't yet seen the sorts of numbers that London have seen. However, as all of us are in the country, we are worried about a second or potentially third surge, and also the impact of taking away the lockdown restrictions and the impact on the southwest that will have on additional surges.
So I'm assuming that you created that extra ICU capacity in anticipation.
Yeah. So it's really interesting. So when we started with the first outbreak of COVID-19 across the country, we were all asked to gear up for rapidly expanding our ICU capacity, emptying our hospitals and converting them into sort of red, amber and green wards to cope with patients that we could expect imminently. And I think that was a real key sort of call to action for myself and my departments in terms of the part we were playing in the COVID response. So we've got, in normal times, we've got around about 40 ICU beds in Plymouth Hospital. And as I said, we were asked to surge or prepare to surge to up to something like 250 beds. So you can imagine that's quite a step up for us. And the planning that needed to go into that was absolutely phenomenal. Rapid sort of thinking about air handling, supply of oxygen, emptying of our current wards and ICU patients into alternative accommodation, thinking about how we could rapidly procure equipment and get that shipped down to the southwest. It really was a huge team effort to think about, the plans that we'd need to put in place, and also then about how we would secure those, procure them, and get them set up and working. So things that we'd never even really thought about, and thinking I never thought in my career I'd need to know about oxygen flow and total air handling units right across the hospital. But I think all of the executive team are now pretty expert in that.
So what changes have you had to make to how you operate as a trust?
So right from the start, we've needed to change the way we make decisions. So the speeding up of decision making right across the system, so not just within the trust, but within the SDP and right across the region has been brilliant. So, we've gone from having sort of monthly cycles of meetings to almost hourly gold calls within the executive team, within the wider system team, which has allowed for rapid, speedy and decisive actions to be taken. And that's sort of disseminated throughout the organisation. So whilst we've been doing that at an executive level, it's also been replicated throughout our care groups and our service lines. So we've had a sort of a triage, if you like, of information flow on a daily basis. That's meant that accurate, snappy decisions are being made on a hour by hour basis in order to cope with the speed of response that was required of us. And I have to say, everybody has really enjoyed that. So that's one of the things as we start to think about coming out of COVID and thinking about our reset and restoration plans. The overwhelming feedback is how much our care groups and service lines have enjoyed that empowerment and autonomy to get on and do things in a speedy way. So we need to think about how we really build on that culture that's been created, not just within our trust, but within the wider system as well. So I think it's been really recognised as a true benefit for how we work as an NHS, as a national health system, as well as how we work internally as well. So, if there's one lasting legacy of COVID, and I'm sure there will be many, that will be a great thing to think about how we can capture that culture of empowerment and build on it.
And you mentioned that your system's been working well to make decisions quickly. Have you noticed any other changes in how your system's been operating? Has anything become easier that you were struggling with before, for example?
So obviously the financial constraints have been suspended temporarily over the last few weeks, which has made the way we operate different. And I think that can't go on forever. We all know that. But we do, as I say, we do need to think about the culture that's instilled in us in terms of how we can make rapid decisions. And it's going to be really interesting to look at the run rate of the new financial year and ascertain how much we are spending, how much it does cost to run a hospital. So we can think about, what is the new financial framework that we need to operate within going forward, and how do we think about making it easy enough to keep those speedy decisions going, but not lose track of the grip and control that we absolutely need. Because I think that's been one of the key changes, particularly in our organisation, which was very much focused on financial recovery and financial turnaround. And we need to think about how we can build on the culture we've experienced over the last few months and turn that energy and channel it into thinking about, right, so how do we then continue with that force for good to turn the hospital into the right size it needs to be, and to make it as efficient as it should be, so that it goes forward in a financially sustainable way.
So we've been living with COVID for a little while now, and obviously you've been working through various stages of development in your trust. But looking back, is there anything you would have done differently with the knowledge that you have now?
I think there's been much more positive developments coming out of how we have worked differently than things that I wouldn't do. So when you ask that, I'm struggling to think of things that we would have done differently. I think the speed at which we've worked has been faultless. So I couldn't ask for anything more from any of my team and my colleagues in terms of the speed and the commitment and the professionalism that I've seen in all areas, not just in my trust, but in the wider system. So people have rolled up their sleeves, quite literally, put down their job titles and their professions and said, what can I do? And I mean that, I've seen that right across from finance staff to anaesthetists to porters to surgeons. Everybody has said, how can I help? And having that common shared purpose has been the thing that has really driven that. So what would I have done differently? I don't think I would have done anything differently. I think being part of this has just really cemented some of the amazing things that we already knew about the NHS and why we all work in it. And I think the question isn't what would we have done differently, but what will we capture from this new way of working, and what can we keep and how do we keep it and how do we develop and build upon that sense of common shared service, common sense of shared goal and aim that makes us roll up our sleeves and all want to push in the same direction. And that's been truly amazing, truly breathtaking. It really has.
Brilliant. You mentioned your finance team in that answer. So can you tell me a bit more about what your finance team have been doing and how they've been supporting you?
Yeah. So first of all, I'm lucky enough to head up the finance and procurement team, and I think they've both been equally tremendous over the last few months. They really have been working seamlessly with all other areas of the organisation. So, the first thing we did was disband and work from home, and we did that as soon as we were given the signal to do so, and that's not an easy task. There were many of the team who didn't even have a laptop, payroll department, for instance, so trying to get them set up and working from home, cashiers, payments team. It really was quite a logistical difficulty setting that up. But you know what? It happened literally overnight. So I didn't even have to ask or set up a Teams meeting or anything. It was just, Sarah, this is what we think we're going to do. This is how I want my team to work. This is what I've agreed. I've got my neighbours turning up with a van to help with taking chairs home and PCs home and laptops home. It sort of just happened before my very eyes. I was bowled over by the speed and the teamwork, the true teamwork in getting people set up properly to work from home. So that was the first thing that they did. The second thing that was really quite incredible was the volunteering. So before we set up a staff deployment hub whereby staff could formally volunteer themselves to offer to help wherever they're needed, my teams were both procurement and finance were on the front foot with that, saying what can we do? What can we do to help? So as soon as we heard about the operational planning being suspended, there was obviously a pause in all the work that was going on through that, and my team were there saying, how can we help? How can we? What can we do? So that was lovely to see. And then I think there's been a shared support network going on between the finance team and the procurement team and the estates and the IT departments, all the back office functions really, which have really been pulled upon like we've never seen before, to work together in a seamless way and helping each other out. So it isn't about, that's not my job and you need to go to this department to request that. This is, of course I can. How can, how can we help you to do that? And would you like me to do that for you? So I've just seen kindness. I think it's summed up by that, Sarah. It's just that, that human trait of kindness that I've seen pouring out of everybody, no matter what job they had, how experienced they are and where they worked in the trust. Just that willingness to help, to transcend their profession or their department in the area and just get on and help get things moved on. And it's truly humbling to watch and be part of.
And I guess that was a big part of being able to increase your capacity in the way that you have as well.
Yeah, absolutely. So as I say, whilst we haven't seen the sorts of numbers that the rest of the country have yet, the fact that we were able to respond and get ready, and also to help out with regional colleagues and offer advice and support right through to the national teams where needed, that just felt really great to be part of that bigger sense of purpose and direction. So it has been. We have felt like we've been a real useful cog in the wheel.
And just thinking about where in the year we are now, I'm curious, how does annual accounts go working remotely?
Yeah, well, very smoothly. So again, we've never ever had to do a year where we've prepared accounts off site and remotely. So touch wood, we're still going through the audit process, but it appears to be going really well, really smoothly. And again, just credit to my team, just that spirit of well, this is it, we're going to get on with it and we'll make it work. And just managing to hit the original deadlines has been incredible. So it does make you wonder why we work in an office at all when you can do this all remotely. But you know what, the answer to that is that we do need each other. So whilst we can absolutely work remotely and get all this stuff done off site, the fact that we know and have such trust and great relationships with each other is born about from working together and being in the office and having that shared team camaraderie. So I think I've answered my own question there. The reason we don't work like this all the time is because we do need each other, and we do need to build those friendships and those lasting relationships that provide the oil to make things work when we go through things like this.
Which leads me nicely into my next question, which is around well-being and resilience, because this has been really tough for people, and I'm wondering how you've been supporting your team, but also the wider trust supporting staff as well.
Yes, a really good question. Perhaps if I start with the wider trust, so we've put in place quite early on access to occupational health facilities. We've really stepped up the availability of that, making that a 7-day-a-week and 24 hours a day access to occupational health and support, with the phone line being manned around the clock. We've put in place, again from very early on, daily calls with all of our teams. So we made sure we had that cascaded through the organisation. So as an exec team, we meet daily on a gold call, and then I meet with my team straight after on a call. And so some of that is about just passing on information to ourselves and making sure we've got the sort of the gold, silver actions moving along quickly. But it is also about checking in on the teams and I mean Microsoft Teams, by visually seeing how people are, making sure they're okay, and obviously that's cascaded right down to every team. And I've been very keen that my teams do that on a daily basis, even if it's only for 5 or 10 minutes. I think that it's important to have that visual of everybody, because whilst we're in a work situation and we are concerned about the operations of the trust, we do also need to remember and have in our minds that every one of us has got a personal life. We've all got either children at home who we're trying to homeschool, or we've got elderly relatives who we're worried about and can't get to, or we've got friends and other family members who've got their own concerns or health issues. That is in our minds as well, and part of the checking in thing is just remembering that the human side and the personal life side of everybody that we are working with, and just managing that and recognising that those wider issues that are going on. And I think the other thing to say, I don't hold back in saying this, is the fear factor. So particularly in the early days when this started out, I think all of us were worried, worried about the numbers, worried about what the impact would be on our families and loved ones, and worried about where this would end up, and managing that and being able to talk about that, I think, has been really key in terms of staff well-being. So making sure we were being open and honest and allowing people to reflect and talk about their worries and their fears, and then giving people time to reflect and be with their families, do the whole homeschooling, and ensure that they knew they had the support when they needed it.
Yeah.
And I think just thinking that through, that's something that's probably going to become more and more important as we come out of this. So staff well-being, and allowing people, making sure we allow time for that staff well-being. We don't just drop the daily calls and the daily check-ins, because I think this will go on for a number of months, and if not a couple of years. The recharging, the reflecting, the having time to just make sure people have been able to reflect and just look at what they've been through, because it may be a few months before it catches up with us. We've all been working at a considerable pace, and when we stop, we're going to really feel it. It is going to come crashing down, and we will feel, it will take us a bit of time to just get back into normal life. And we all need to, remember that every one of us will go through that differently. And so managing that through the work situation is going to be key. And I don't have the answers, but I think just talking about it is going to be helpful, and just letting people reflect on their experiences is also going to be really key.
Yeah. It sounds like a really important lesson in terms of managing staff and well-being for the future as time goes on. Yeah, I think you've touched on a few other things that you would like to keep for the future, but are there any particular lessons you'd like to highlight that might change what you do in the future and how your organisation operates?
I think it's really brought to light the importance of system working, and so we were all working well in systems, in STPs to a certain extent before COVID hit us. But I think the COVID response phase has really sort of shone a light on how systems do function, the need for rapid communication and decision making, and also to think about the impact of who does what, and how do we get things done, and how do we as a system move to support the objectives of the individual organisations. And having that common purpose and that common goal has been really key to that. So I think we are going to see some changes to system working. I think there's been a real strong focus and great things achieved through how we work as a system. But I think it would be great to see that really accelerate and develop as we come out of COVID, to make those systems much more functioning in a much more effective way.
And you mentioned that the removal of the financial constraints had helped some of that system working. Yeah. So what would you like to see in the future when we start to think about the financial regime?
It would be great to have a much more simple financial regime, and all be that for perhaps for the rest of this financial year. But to allow us the headroom and the resources, and I mean manpower resources, to get on and do the proper resetting and restoration. So thinking about pathways of care, how we keep the improvement in flow through our hospitals, how we clear the backlogs. I think that's where we need to focus our energies. So if we're able to almost suspend PBR and contracting for another 8 months, so that we've got that bit of headroom and that additional resource to really focus on cementing in the good changes and making them sustainable, will be really helpful. Coming out of that phase, I think we need to think about the future of contracting and how we make the financial incentives drive the right behaviour. I think we're already on that path before COVID took over, but it would be great to get back into a sort of a focus on making the money deliver the right care pathways. And I mean that right across the system, so not just at an organisational level, but how do we enable place-based healthcare to work? So right from primary care to acute to specialist care to community care and to social care, without the barriers and the contractual arguments that get in the way. So that for me would be, if COVID could help accelerate those conversations that had already started into giving us a financial framework that really makes the pathways of care deliver the right thing for the patient, that would be fantastic.
That's been really interesting. Thank you for your time today, Sarah.
Pleasure. Good to talk to you, Sarah. Thank you.
All of the HFMA's COVID-19 related briefings, blogs and news articles are openly available on our website, hfma.org.uk. There is no need to be a member to access these, so please tell your colleagues. We have also launched a forum where finance colleagues from across the NHS can discuss issues and challenges in a safe space. You can sign up via the link in the network section on our website. If there are particular topics you would like future podcasts to cover, then please get in touch via our email address, policy@hfma.org.uk. Thank you for listening to HFMA Talk. Don't forget to subscribe to this podcast to keep up to date with new episodes.